So hey, it's Nancy, the nurse practitioner. Just want to say hi to everybody out there. I am with my husband Steve. It is day what? 19?
19.
Day 19 since he had his Mako total hip replacement. So I just want you to know that on day 4 he was mowing the lawn. He no longer needed the walker within the next day or two after that, and then the cane is gone. He's doing his exercises, goes to physical therapy, and now he's driving the car. We're going to the nursery to get some flowers. So I do want Steve to tell you, one thing we did want to make sure you know is don't forget the urinal when you leave the hospital or the surgery center, and don't get out of bed if you can help it the first 24 hours. The thing I want to say is that, one thing I did mention is that you need to bring the urinal home. And for women, as funny as this sounds, but there's something called Lady J, which is a device you could actually buy online. It has a large opening, so you can actually put it on yourself and then put a urinal attached to it as a spout at the end. It's very interesting. You could buy that from this company called something Defense. You can go online and get it. But also get a bedpan if you're a woman. A flat bedpan, a fracture pan it's called, and that will make it easier for you to go in the bed and not get up, because those first 24 hours is when people have the anesthesia wearing off, all the drugs that have been given to you, and if you're drug naive like my husband was, all these things are reacting and you get pretty loopy. Your blood pressure drops, you get dizzy easily, you vomit. He did vomit one night. So be careful and take those first 48 hours really seriously. But then you can really progress very well. Is there anything you want to tell anybody, Steve, that I can share with them? Let's give you a picture, Steve.
No, I think you covered it all. Like I said, the first 48 hours, just be very careful, like Nancy said. That's the critical time.
Okay, and how's your incision feeling?
Incision feels good, a little sore, but again, it's only 2.5 weeks out. So
you
far,
had staples,
according to the physical therapist, that's to be expected, and everything's going very well.
Okay, so you had like 9 little staples taken out where the robotic arm was put in, which is above the main incision, and then the doctor put steri-strips on just to kind of keep the incision together, right? And you can't submerge it for another 2 weeks. It's got to be a full month, right?
Correct. And you keep taking the baby aspirin for blood clots for
twice a day,
probably for a whole month. But that's
he said 6 weeks.
That's the important part.
Yeah, because you don't want blood clots. And the other thing was, sometimes he overdoes it, right? So we decided to stay on the Celebrex for a while longer. And
Celebrex is as needed, and you're going to find if you're going to keep busy and active, you're going to need Celebrex every once in a while.
Yeah. So just want to make sure you guys knew that it's a good thing. He's feeling so much better and doing the exercises he's supposed to do, and now all he has to do is do the strengthening. He's got full range of motion of that hip. Yay. All right, take care, everyone. We'll see you at the next video. Bye.